Today we are going to talk about odontogenic keratocyst. Odontogenic keratocyst is a developmental odontogenic cyst. Its name is derived as it contains keratin in the cyst lumen. Its major characteristics include flattened epithelium to connective tissue interface and the palisading of basal epithelial cells and reminiscent of odontogenic epithelium. Who classified this cyst based on its aggressive behavior, recurrence, and mutation PTCH gene. It is mainly derived from the restus of the dental lamina, and its distinctive histological features include corrugated parakeratin layer, uniform thickness of the lining epithelium of 5 to 8 cells thickness, and palisaded basal cell layer. Its clinical features include it occurs more often in 10 years of age in young people, and its peak incidence is about second and third decades, and males are affected more than females. It occurs more in mandible than in maxilla. In mandible, firstly, the ramus third molar area and the first and second molar areas are affected more, and in maxilla, the third molar area and then the cuspid region. These lesions, if it occur in children, it may cause multiple occlusions, and which is a major component of the NBCCS syndrome. And in 50% patients, the cyst shows symptoms like pain, soft tissue swelling, expansion of bone, drainage, paresthesia of lip or teeth. Aspirate from this lesion shows cheesy material of the keratin, and sometimes a straw-colored fluid may also be seen. Coming to the radiographic features, it shows unilocular radiolucency, but multilocular radiolucency is also observed, and there is a well-defined peripheral rim with scalloping of the border. Then differential diagnosis. In multilocular radiolucent cases, there are satellite cystis present when it occurs in mandibular third molar area, and this may be confused with ameloblastoma. If this cyst contains a crown of an impacted tooth within its lumen, then it may be confused with the dentigerous cyst. But the final diagnosis is done only through biopsy, and this multilocularity is seen in about 20% of cases, whereas the unilocularity is seen in about 40% of cases. In pigmented occlusions are seen in the young females of average 18 years. The pigmentation is due to the presence of melanocyte without atypical features within squamous epithelium of the tumor. The histological features of occlusion. The wall of occlusion is thin unless an inflammation occurs. The parakeratinous surface shows corrugated, rippled, or wrinkled surface. The uniformity of thickness of epithelium is about 5 to 8 cells. Palisaded, polarized basal layer of cells may cause a picket fence or tombstone appearance of the cyst. And stratified squamous epithelium is present, which comprises of orthokeratin or parakeratin or both. Orthokeratin is present in about 10% and parakeratin 83%, and the both ortho and parakeratin is about 7%. No reddy ridges are seen, and the epithelium usually peels from the connective tissue. The connective tissue wall shows small islands of epithelium, which are called as the daughter cystis, and the dentinoid formation is an unusual feature in OKC. The lumen of keratocyst shows thin straw-colored fluid or thicker creamy material, and it may also present with cholesterol or hyaline bodies at sites of inflammation. And some uncommon features like dysplastic and neoplastic transformation of the lining epithelium is also seen. Moving to treatment and prognosis, the cyst is surgically excised, but its complete eradication is difficult because of the thin and friable cyst wall. So there is a recurrence rate about 13% to 60%. And it is more frequent in patients with NBCC syndrome, about 63%. And if they don't have the syndrome, its recurrence rate is only 37%. Keratocyst enucleated in one piece required more than the cysts which are enucleated with several pieces. OKCs in the mandibular molar region or in the angle or ascending ramus are prone to high recurrence. Other methods or treatment methods include marsupialization, peripheral ostectomy or bony resection, and enucleation and primary closure, enucleation and packing open.